Andre, can you guys see my screen? I usually don't use Microsoft Teams, so I just want to be
Yeah,
sure you can.
yeah,
Okay,
we can
cool.
see it. Yep.
Morning or afternoon, everybody, wherever you are. My name is Corey Kynes. I'm National Sales Director with Sidecar Health. I appreciate you taking the time to learn more about our product. We think it's a great solution in general, but definitely for 1099 and contract employees. So I'm just going to go into a little bit of a PowerPoint slide that we've put together, and then I'll take you into our website as well. You can go with me to see how to purchase our product, what the prices would be for you, the plans that we have to choose from, and then I'll also show you the technology that we've developed that allows you to see what doctors and facilities charge for everything that we cover and what all pharmacies charge for every drug in the U.S. healthcare system. Um, just a little bit about Sidecar Health. We've been around since 2017. The reason that the company exists and that this product was invented is because of a personal experience that our CEO had. He had a high deductible health plan, which I'm sure a lot of you have or have had in the past, and he had not hit his deductible yet, and he had to go get an MRI. And so when he went to go get that MRI, he got a bill in the mail about a month later for $1,300. So he had to pay the full freight because he hadn't hit his deductible yet. So $1,300 out of pocket. And then about a month or two later, after he had a procedure, he had to go back. He had to go back to the same facility and get the same exact MRI. And instead of running it through his insurance plan, he asked, "Can I pay cash? And if so, how much will the cost be?" And they said, "Sure, you can pay us cash today, and it'll be $330." Which kind of blew his mind that he could save nearly $1,000 by not using his insurance plan and just by paying cash. And so his wheels started spinning. He did a lot of research and found that paying cash at the point of service or using, a credit card, a Visa debit card, whatever, um, triggers huge discounts from providers. And the main reason for that is that they just get paid. I don't know if you know this concept in general, but a lot of doctors' offices and facilities, all of them really, have people that are there strictly to chase money. They set up payment plans with their members, which can take them a while to collect. Typically, when they do that, it's turned over to a collection agency, and on average, they collect about 20% of every dollar they bill for, which is not a good business practice, obviously. So, since they only collect 20%, they have to charge a very large amount to get the money that they need to operate their business. So when you come in and say, "I'm paying cash today in full," they'll give you a huge discount for that convenience most of the time. Um, Although this is a great concept, a lot of people don't have enough cash on hand to pay for the big ticket items, like a knee surgery or rotator cuff surgery or anything that may be expensive. Even an MRI, if it's $1,300, a lot of people don't have that laying around. So if you don't have that cash on hand, you can't take advantage of those big discounts. So what we've done is we give all of our members a Visa debit card. They use our money. They use Sidecar Health's money to pay for everything that's medically necessary and every drug in the U.S. healthcare system. So it's very easy to understand. It's very different from what you're used to, but to simplify it, you use this card, you go anywhere that you want to go, anybody that accepts Visa. So we don't have networks, it's just anybody that accepts Visa. You present as a self-pay customer. We cover everything medically necessary. We cover every drug in the U.S. healthcare system. Our plans don't have deductibles to start, so you're actually getting care when you need it instead of having to pay for it yourself after you've paid all these high monthly premiums. And our premiums are about 40% lower than average because the facilities and hospitals and pharmacies charge our members less because we pay them in full upfront. Um, the coolest part about the whole thing is the technology that we've built that I'll show you in a second that allows members to look up what facilities charge and be able to shop for your coverage. Um, you can shop for everything that you purchase today, from groceries to clothes to cars and whatever it is that you buy. You always know what it costs before you buy it. That's not the way healthcare works. You show up to the doctor, you don't know what they charge you, what they're going to charge. You don't know if it's competitive, and then you usually get a bill in the mail, 6 months later or so, and it's very frustrating. We're trying to eliminate all of that. So does anybody have any questions so far? No? Okay. Andre, Brandon, can you see the screen here?
Yes.
The new screen with the website?
Yes, we can.
Perfect. Okay. So actually, I wish I could see this screen and put the link to your...
I do have a question. This is Wesley Rice.
Sure, go ahead.
So you mentioned that you had the ability to shop for anything, but in an emergency situation, it's kind of hard to negotiate. So how does that work?
Correct. Yeah. In an emergency situation, not only is it hard to negotiate, you wouldn't have time to shop for that coverage, right? You just go take care of yourself. So say you have a heart attack and you just call the ambulance, you go to the hospital, you take care of yourself. Most hospitals are going to ask you if you have insurance. With our product, you're going to present as a self-pay customer, and they will typically ask for a down payment in the ER of roughly $500. You can use your Sidecar Health Visa debit card for that payment, and then they'll take care of you. You'll go home. They'll send you a bill. In that scenario, don't pay that bill until you send it to us, because we'll look through each CPT code and procedure, see exactly what they billed you for, compare it to the averages in that area, and compare it to our benefit amount, and we'll make sure that they're not charging you a ridiculous amount. If they are, we'll negotiate with them. And on the back end, initially they think they're dealing with an uninsured customer. And so they think it's going to take them forever to collect the money, or they may only collect a portion of it, like I mentioned earlier. When they hear from Sidecar Health that, let's say it was an expensive stay, $30,000 bill charge, and our benefit amount is $25,000. If we call them and say, we'll pay you $25,000 today, they say, that's great. And they write off the rest because they don't have to wait. They just get paid right then and there. So providers love hearing from us. They love working with us because we give them the cash they need right now. So hopefully that answers your question.
Yes, it does.
Okay. Trying to see if I can find this link in the chat. Sorry, I'm not used to navigating Microsoft Teams. Here we go. Okay, cool. So this is, you can see the screen still, right? For Obsidian Mortgage, Brandon? No?
Yep, I can see it.
Okay, cool. So this is the link that you guys will use to access Sidecar Health. SidecarHealth.com for Obsidian Mortgage, and Andre put it in the chat too if you want to find it there and walk through this process with me, so you can see, first of all, if you qualify for coverage. There are some health underwriting questions. It is also based on your zip code. We're in 16 states right now, so if you're on this call in a state and you live in a state where we aren't active, you could save yourself some time and maybe hop off this call for now. But if you don't mind, go into the website and type in your zip code, and I can show you how to get a quote. Oops.
So, excuse me, I'm just wondering, are you guys in California or plan to be soon?
We're based in California. We're not approved in California yet. Our home office is in California, but the plan has not been approved by California yet. It was going to be approved about 15 months ago, but they're pretty difficult to work with, and COVID didn't help. So.
Okay, thanks.
Do you have an idea on when that time frame might be, Corey?
What's that?
Do you have an idea on when that time frame might be? How close you guys are to that approval?
I don't. Again, I thought it was going to be a long time ago. And anytime I ask the people that our company work with, when they work with the regulators, a time frame, they just say they sent over objections and we're responding, and that just keeps happening back and forth with a lot of time in between. So I don't really have a realistic idea of when that'll be approved. I'm sorry.
That's all right. Sounds just like the mortgage industry. So,
It sounds like it depends on the mood you catch them in sometimes, because some of these states could approve us in like a month. So this is the whole process. You'll type in your name, email address, date of birth, gender, who you're looking to cover. You can cover a spouse, you can cover children without being covered yourself, which is pretty cool. Most plans, you have to be covered yourself, especially through an employer's plan. Then you just answer these health questions. I can tell you, just to save you a little bit of time, you can currently be pregnant, you can use tobacco, you can have visited the chiropractor or psychiatrist. Any of these 4 things are okay. They will just rate up your premium a little bit. But anything else that you choose of these options is going to give you this screen here, and I'll show you. It's going to show you we may not be your best option. That just means that you can't purchase Sidecar Health. Our rates are so expensive at that point that we know that you can find better coverage elsewhere. So that's, if you see that, then Sidecar is just not the right fit for you. But I'll take you through this. Enter any prescriptions you may be taking or procedures you may have. Again, you can quote another person, you can add a spouse or children. These are individual policies, so each person in your family will have their own premium and get their own Visa debit card, because you can buy different plans for each person. I'm just going to see quotes so you can kind of see ballpark premiums. I did this on myself in Texas. I'm 39 years old, just to give you an idea. The older you get, the more expensive it is. So these are our most popular plans. These plans, this annual coverage represents the amount of money that we'll spend on your behalf in a year, and it resets every 12 months. So this is our most popular plan and our richest plan, $2 million a year. Our plans start with no deductible. As I mentioned, we cover all prescriptions and all medically necessary care, and you can add maternity, and you can also add a 3-year rate guarantee at the end of checkout, which is kind of unheard of in health insurance. If you have any questions during the enrollment, we have our member care team here that can help you. You can just enter a message and ask questions, and they'll be there to help you navigate, because it is a little different concept, so we want to make sure you understand it. If none of these plans really work for you, you can customize this over here as well, which is a really cool feature to me. So say you want the max coverage we allow, but you don't want to pay $335. You can add a deductible, or you can turn prescriptions off in most states. Tennessee doesn't have deductibles, I don't believe, so you can't add a deductible in that state. But in most states, you can customize this to get this premium down to wherever you want it to be. Totally customizable. So just know that as well. Any questions on the enrollment process or purchase process? Also, probably important to know that you can buy this plan at any time. Like, you don't have to wait till open enrollment. That's one unique feature about our product is if open enrollment ends August 15th, like we think it will, and you miss that window, you can buy our product anytime you want. So you just click on here, set up an account, and you have a 14-day waiting period before coverage begins, and we'll send you this Visa debit card in the mail in about 7 days. We send text messages and emails on how to download our app to Android and iPhone and how to use it. And we send our member care team keeps in touch with our members and sends them little reminders on how to use it and the fact that we don't have networks, and we want our members to use our product so they can take care of themselves when they need it.
This is Suzanne. I have a very quick question,
Sure.
or I guess a couple. Do you have a list of your current 16 states somewhere, or do you have to enter the zip code and start the process? And my second question is, does any of this include vision or dental?
Mm-hmm.
Does not include dental or vision yet, so you would need to purchase that separately through another carrier. I apologize, I keep asking this, but can you see my screen now? With
Yes.
the map? Okay. So this is the map of where we are live in all the states that we're in.
Thank you.
You're welcome. Just leave that up for a second for people to look at. And we can send this out to you, Andre, if you don't have a copy of this. It was actually just updated because we got approved in Michigan a couple days ago. It's not live on our website yet, but we just got approval.
Yeah, if you could send me that slide, that's great. We actually have the sign in and everything on our intranet site so that people can just go there, but I'd like to add the map so that they can
Sure.
keep coming back and checking to see when, like, for example, California is available and some of the other states. And we just actually got approved in Michigan as well. So,
Oh, great. Good.
yep. So that's great.
Yeah, Brandon, do you mind sending that to Andre, the one that Liz sent out on Monday?
Yeah, you got it.
Thank you, man. So I'm going to take you through the members experience just to show you how to use the product. And again, I'm a customer myself. I use my phone for everything, and our app is great. I like it even better than our website for iPhone. But basically, how you use the product is before you go, for elective things or outpatient procedures, you can shop. And so you just go to estimate care. Let's just say you needed to go to the doctor, something simple. Click on doctor visits and click on the area that you're in. I'm just going to use Plano because I used to live there and we have quite a bit of business in Dallas. I can use Orlando or whatever you want me to look up if you want me to. Just to get the concept though, you type in the area that you're in and what you're going to get done, and then look over here and it shows you what our benefit amount is. So to me, this is the most important number that you need to look at before you go get your care. This is basically like a $143 gift card that Sidecar Health is giving to you to go shop for a doctor visit. So then we show you all the providers that we have information on and what they charge for a doctor visit. So Catherine Johnson charges $75, which is great. You can go see Catherine, swipe your Sidecar Health Visa debit card when you're done. We're going to send you an email saying, please upload a receipt, because we don't know what you did at that point. So you take a picture of the receipt, upload it through our app or email it to our member care team. And in 7 to 10 business days, we'll adjudicate this claim and look at it and say, okay, our benefit amount is $143. You only spent $75. We owe you personally $68. So you get to keep the difference of what our benefit amount is and what that charge was. So we'll then ask you if you would like a check for $68 and we'll mail you a check, or if you want us to lower your next month's premium by $68. So if you're paying $100 a month, next month you'll just pay $32. So you personally benefit by shopping and going to lower cost facilities. On the flip side, if you want to go somewhere that charges a little bit more, let's say your doctor was Kelly Wimberly. She charges $175. You can still go see her, right? We don't have any networks. Anybody that takes Visa will take our product. You pay her, upload a receipt. Once we get it, we say, all right, our benefit's $143. You spent $175. You owe us $32 in this scenario. So we're going to ask that you authorize the charge for $32. Every time somebody enrolls in this product, you have to enter a credit card, a personal credit card or debit card that is there to take care of these transactions if necessary. So once you authorize that transaction, we just pull $32 from your personal credit card or debit card, and then we're all square. So there's no paper bills, there's no balance billing. It's all done electronically behind the scenes. Any questions there?
I do think it's important to note, although that we're only live in 16 states, like if you were on vacation in Nebraska, you're able to get coverage there as well. So anywhere in the United States, you're able to get coverage as long as you have your plan in the state that is live.
Good point. Yeah, you have to reside in one of our 16 states to purchase it, but you can use it anywhere in the country that accepts Visa, or you can use it outside of the country as well.
Hey guys, quick question. How does it work with like telehealth, telemedicine?
Yeah. You can do the same thing. I wish I'd done this the other day. I was sitting in the doctor's office for an hour and a half with my daughter who was sick and going, why did I not do telemedicine? But same thing, you just type in telemedicine, it'll bring up a list of providers if we have information on them and show exactly what they charge. And then it shows what our benefit amount is. So I've done telemedicine a couple times. I think it was $40 both times to FaceTime a doctor. So in this scenario, they would charge you $40. You'd give them your Visa debit card, pay the full 40. Our benefit amount would only be 28, so you'd owe us $12 in that scenario. Make sense?
Yeah, it totally makes sense. I was just curious because, you know, it's like when you do that, is that giving you a list of doctors that actually provide that service? I know there's like some websites that have it as well, you know,
Yeah.
where you can go and even if you don't have a doctor, you know, like, you know, there's like telematics or whatever. Are those covered as well, or does it have to be a local physician?
It doesn't have to be a local physician. Again, we cover everything that's medically necessary. And this information that we have here, from the procedure standpoint, is only based on information that we've been able to collect. So if one of our members has submitted a telemedicine expense, we take that expense and put it in our system. So that's probably what happened here. This person charged $75 and our member was left with $47. But we don't have a whole lot of information on telemedicine in the North Texas area. But if you, Andre, if you Googled telemedicine providers in Florida and found somebody and did that over the phone and sent us the expense, you can go anywhere you want to go. You don't have to go to this list that we have. You can go anywhere you want to go and submit that expense, and we'll reimburse you. And then that list will be in here, or that transaction will be in here for the next person to see. Does that make sense?
Yeah, it totally does. Yep.
Okay. Yeah, and I also it's important to know, like, if your doctor isn't on here, a lot of people have the misconception that we don't work with that doctor. We work with anybody that'll accept Visa. So let's say your doctor was Ryan Lewis. We don't have information on Ryan. That doesn't mean Ryan doesn't accept Sidecar Health. It means we don't know what Ryan charges for a doctor visit yet. So if you went and saw Ryan for a doctor visit, we would get that expense and put it in here for the next person to see. So this list just continues to grow and grow and grow.
This is Suzanne.
Yeah.
Sorry, I didn't mean to interrupt. Do you have a list of covered medical expenses, procedures? What was the term?
We do. Brandon, do you mind putting sidecarhealth.com/FAQ in the chat?
You got it.
Or Andre? On our website, there's an FAQ tab that shows everything that we cover. It's really more of everything we don't cover, because we cover over 170,000 procedures and every drug. So we really list like the 20 things we don't cover that are pretty logical. It's mainly cosmetic things that we don't cover. I just want to show you this too, so you can see this. Same concept applies for pharmacy. So if you elect the pharmacy benefit in your policy, you can use this technology to shop around for your drugs as well. And I just used Crestor generic. It's a popular statin. Shows our benefit amount here, $49. Shows you all the pharmacies and exactly what they charge. Renaissance Diagnostics charges $15, so you would make $34 every time you got this filled every month if you went there. CVS and Walgreens, I just want to show this to you guys, that while they may be convenient, they're the most expensive by far on generic drugs, every time. On name brand drugs, they're more in line with the rest of the pharmacies, but on generics, they charge 10 times on average what other local pharmacies would charge. So if you can go to CVS, you can go to Walgreens, but you're going to pay more. So we're only going to pay our benefit amount no matter where you go. If you went to CVS, you'd owe us $180, or you could go here and make $34 right across the street. So I just wanted to show you that. Uploading expenses is very easy too. You just take a picture of the receipt. As I said, I do it on my phone, or you can go here and download the receipt to your computer and upload the receipt here. And that goes to our member care team, and we adjudicate those in 7 to 10 days. And this is where you'll view your dashboard, which keeps up with the amount of money that you've spent in a year. And as you spend money, this goes down, so you are very aware of how much you have left. So just in case, Susan, you weren't able to go to the FAQ, I just wanted to pull this up so you can see benefit coverage questions. What does Sidecar Health not cover? Here's that list. I'll just leave that up for a second. And again, this is at sidecarhealth.com. Our website has a lot of information on it. Brandon, anything I left out or anything you think should be added, discussed?
No, you touched the main points that I would highlight. Nothing that you missed on my end.
Anybody have any other questions? Okay. I know this is a very new concept and a new company. So a lot of times on these calls, it doesn't happen as much lately as it did when I first started, because we've been around for a while and I think we're starting to build a pretty good reputation. A lot of people ask, what's the catch? Because this seems too good to be true. It's not too good to be true. I mean, it's really logical when you think about it. When you implement the cash pay concept, providers charge less, so our members pay less. We're just collecting cash prices and building this technology for everybody to see, so it's a transparent marketplace. I'm a customer myself. The member experience is great. The member care team answers the phone, they reply on the chat, they're super helpful, and the product itself is very easy to use. So if you have any questions, feel free to reach out to me or Brandon, or through Andre, and we're here to help.
Yep, and again, everybody, the sign up site is on the intranet. I will get the map and everything posted, as well as a copy of this recording for you in case you need to watch it again. I don't think I have your contact info, Corey, so if you could shoot that over to me. Oh, okay, you guys put it in the chat. Perfect. Yeah, if you want to shoot that over to me, that way if I have any other specific questions, I can ask them or Brian. So there
Sure.
we go. Great.
Yeah,
Much appreciated, guys.
Sorry about that, Andre. Yeah, I just put our emails in the chat if anyone wants to reach out with any additional questions.
That's perfect. Yeah, and just keep us posted on states as you add them in. We'll be really happy. We have a very large group of loan originators in California. California and Florida are probably our two biggest areas. So we would love to get on in California. I know there's a lot of people interested in signing up there. So
I know Brandon hopes we do too. He's out there in LA just chomping at the bit.
Yeah,
yeah. California's a difficult state for everything, but
Right. Okay, well, it's good to meet you, Andre, and everybody. If you have any questions, you know where to find us, and I appreciate your time, and have a great rest of your week.
Thank you, guys.
Thank you.
for the time.
Thank you. Bye.
Thank
Thanks,
you.
guys.
Thank you.
Thank you.